911, where's your emergency?
I need an ambulance right away. My son just overdosed on heroin.
What's your address?
Please, he's unconscious. Please, hurry.
Combo 911, where's your emergency?
Hi, I'm X-Pack Discounts. My friend just overdosed on heroin.
Please, hurry.
Stay on the phone with me. Stay on the phone with me, okay? He says it's overdose on heroin, right?
Yes.
Okay, how old is he?
He's 21. Oh, my God.
The opioid crisis has become one of Canada's most devastating public health challenges, deeply affecting people who use substances, as well as their families and communities nationwide. Since the Public Health Agency of Canada began tracking the issue in 2016, opioid-related deaths have risen dramatically. The situation grew even more severe during the COVID-19 pandemic. The opioid crisis in Canada is a devastating public health issue for many reasons. Chief among them is the profound and preventable loss of life among individuals who use opioid substances. Thousands of lives are lost every year due to this crisis, leaving behind grieving loved ones and communities struggling to cope with the loss. Beyond the statistics are real human stories of pain, trauma, and missed opportunities for support and care. What makes the opioid crisis especially heartbreaking is that many of these deaths are not only preventable, but also linked to broader challenges such as poverty, social isolation, mental health struggles, homelessness, and traumatic life events, or a combination of these factors. People who use opioid often face high levels of stigma and barriers when seeking help, making it harder to access support without fear or judgment. Communities including Indigenous populations, racialized populations, and other marginalized and unprivileged groups have been disproportionately affected, highlighting deep-rooted inequalities. This crisis is not just about drugs. It reflects gaps in compassion, systems of care, and social support, making its impact deeply emotional and devastating. Opiates are a group of drugs that come from or are designed to act like substances naturally found in the opium poppy plant. They affect the brain and the body by changing how pain is felt, often providing powerful relief, but they can also produce other effects such as relaxation, drowsiness, or state of feeling high. Opioid is the most accurate term, although these drugs are sometimes referred to as opiates, painkillers, or narcotics. All opioids work in similar ways. Opioids work by interacting with opioid receptor. There are several types of these receptors, each responsible for different effects of the drug. These receptors are located in areas such as the brain, spinal cord, and digestive system. Opioid medication travel through the bloodstream to reach these receptors where they help reduce the perception of pain. They activate as an area of nerve cells in the brain and body called opioid receptors that block pain signals between the brain and the body. The main difference between opioids lie in their strength, how much of the drug is needed to achieve an effect, and how long their effect lasts in the body. Common examples of opioid include codeine, morphine, hydromorphone, oxycodone, and fentanyl. When opioids are misused, they can produce intense feeling of pleasure or euphoria, but they also carry a serious risk of overdose, which can be fatal. While opioids can be very effective for pain management when taken as prescribed, their strong effects make them highly addictive and increase the risk of dependence when not used properly. Canada's opioid crisis has developed over several decades. In the late 1990s and early 2000s, opioids such as oxycodone were increasingly prescribed to manage chronic pain, leading to higher rates of dependence and misuse. By the early 2010s, government began tightening prescription controls, but this shift pushed some people toward illicit drug markets. Around this time, highly potent synthetic opioids like fentanyl and its analogs began appearing in the illegal drug supply, greatly increasing the risk of overdose. By 2016, the Public Health Agency of Canada officially began the national surveillance as deaths rose sharply. The crisis continued to escalate, affecting communities across urban and rural areas. During the COVID-19 pandemic, overdose deaths surged even further, driven by factors such as isolation, disrupted services, and more toxic drug supply. Today, the crisis remains a major public health emergency, prompting ongoing harm reduction, treatment, and prevention efforts nationwide. According to the Government of Canada report, between January 2016 and December 2025, there were about 56,631 reported deaths in Canada linked to opioid toxicity. In 2025 alone, 5,630 of these deaths were recorded, with 96% being accidental. The majority of deaths, nearly 80%, are concentrated in three provinces: British Columbia, Alberta, and Ontario. Additionally, statistics from last year shows that opioid-related deaths were more common among men, who made up 73% of the cases, with most affected age groups being those people aged 30 to 39. In the same year, emergency medical services responded to around 39,403 suspected opioid overdoses. This resulted in emergency departments seeing 23,291 visits related to opioids, averaging 64 visits per day, and nearly 5,000 hospitalizations. An important point in the statistics that is often overlooked is the growing trend of opioid use among youth, those aged 15 to 24, particularly during the COVID-19 pandemic. In Ontario alone, 9% of all the opioid-related emergency department visits and 8% of opioid-related deaths occurred among individuals in this age group. This highlights a concerning increase in opioid-related harm affecting younger population. The opioid crisis in Canada remains an ongoing and deeply troubling issue. Although we have seen slight declines in yearly deaths in recent years, the number of lives lost each year is still far higher than what it was a decade ago. And as long as thousands of people continue to die and countless families and communities are left grieving, this crisis needs a strong and sustained political action. This is not just about individual tragedies, it reflects the broader systemic failure. Opioid-related deaths places increasing strain on the already overburdened healthcare system and continue to widen the social inequalities. Many of these deaths are preventable, yet they persist, pointing to the gaps in mental health care, addiction treatment, and harm reduction services. Far too often, people fall through the cracks of a system that is meant to support them. Addressing the opioid crisis and implementing effective solutions is complex, as it is shaped by multiple socio-political and economic barriers. First, stigma and negative attitudes towards addiction and substance use remains widespread. Second, financial constraints create significant challenges. Limited funding for health and social services restrict access to timely, evidence-based care. This is especially apparent in rural areas and in communities that have been historically and systemically marginalized, including indigenous communities. Third, political disagreements and shifting priorities across federal, provincial, and municipal government can result in inconsistent, delayed, or fragmented response to the crisis. Together, these barriers highlight the urgent need for sustained political commitment, stronger collaboration across sectors, and implementation of compassionate, evidence-based solutions to effectively address this ongoing public health emergency. There are several important stakeholders that must be considered when discussing the opioid crisis in Canada. First and foremost are the individuals who consume opioids. They should be at the center of the conversation as they are directly affected by the opioid crisis. Their needs drive policies such as harm reduction, improved treatment access, and safe supply programs. Second are families and caregivers who also experience the financial, emotional, and social toll as loved ones of individuals who use opioids. There are important stakeholders because they are often involved in care and overdose prevention. Third are healthcare providers. This group includes doctors, nurses, social workers, pharmacists, trained staff, and harm reduction sites. Healthcare providers are key stakeholders because they play a significant role in prescribing, educating, and managing treatment. They also implement strategies, educational campaigns, and non-judgmental interventions to meet individuals where they are and provide support. Academic institutions and researchers are also important stakeholders as they provide much needed evidence-based insight to guide the creation of policies and evaluate effectiveness of interventions. Finally, all levels of government are key stakeholders, from municipal to federal level. They are responsible for making policies, providing funding, and making decisions that support public health initiatives. At the micro level, interventions focus on directly supporting individuals affected by opioid use. This include harm reduction approaches such as naloxone distribution and education, mental health support through counseling and trauma-informed care, and clinical treatment like opioid agonist therapy such as methadone. These strategies aim to reduce immediate risk such as overdose and death while supporting recovery. However, their effectiveness depends on access to broader services. At the meso level, the focus is on health system and community support that enables consistent delivery of micro-level care. Supervised consumption sites expand harm reduction efforts by providing safe, monitored environments, while integrated care models ensure coordination between hospitals, primary care, and addiction and mental health services. These approaches improve access and continuity of care, reducing barriers such as service fragmentation and stigma. At the macro level, policies and funding create the foundation that sustains both micro and meso level strategies. This includes investing in addiction treatment, harm reduction programs, and mental health services, as well as addressing social determinants of health such as housing, employment, and poverty. Policies like diversion programs also reduce stigma and support access to care. Overall, macro-level investments support meso-level systems, which in turn enable effective micro-level care. Aligning strategies across all levels is essential to address both the immediate harms and root causes of the opioid crisis. The effectiveness of these strategies can be evaluated using measures at the micro, meso, and macro levels. At the micro level, individual outcomes such as reductions in overdose incidents, increased naloxone use, improved mental health status, and retention in opioid agonist therapy can be tracked. Patient-reported outcomes and satisfaction with care also provide insight into effectiveness. At the meso level, service utilization indicators such as visit to supervised consumption sites, wait times for addiction services, and continuity of care can assess accessibility and coordination. Rates of emergency department visits and hospitalization related to opioid use can further reflect system impact. At the macro level, population health indicators such as overdose mortality rates, prevalence of opioid use disorder, and housing stability can be monitored. Policy and funding impacts can also be evaluated through program reach and sustainability. Together, these measures provide comprehensive multi-level assessment of effectiveness. Addressing the opioid crisis requires an interdisciplinary and cross-sectoral approach, but nurses are uniquely positioned to lead meaningful change. As one of the most trusted and accessible health professionals, nurses interact with individuals and families across the continuum of care, enabling them to influence outcome at the point of care through compassionate, trauma-informed, and evidence-based practice. Beyond direct patient care, nurses play critical roles in health education, prevention, harm reduction, and support for recovery. Nurses' contributions extend to research, policy development, and advocacy, where they can champion equitable access to mental health, addiction, and harm reduction services. By leveraging the expertise and leadership of nurses, they have the potential to drive systemic change and improve outcome for individuals and communities affected by opioid addiction.